Hello, everyone. My name is Martha. I'm a relationship counselor and clinical sexologist, and I'm with another counselor, Jacqueline Vanderbilt. Jacqueline Vanderbilt is in Netherlands, and she is quite a celebrity over there. She focuses on helping people with vaginismus, and I'm in Singapore, and a lot of my clients have vaginismus. And in the previous videos, we talked about who we are, what we do, and in the second video, we then talk about her treatment of clients with vaginismus. In the third video, I talked about my treatment roughly with clients with vaginismus. In this video, we want to talk about beyond vaginismus.
Yeah.
So Jacqueline, any thoughts, insights?
Yes, what I think it's important that if you can have intercourse, you can have intercourse, but for me it's not enough. I want the clients to get that you can have intercourse with pleasure, because why should you do anything when it's not pleasure, when it's not with pleasure? And it's like intercourse is not all you can do in sexuality. You can have it all when you want it in all the things you can do in sexuality. And I found it really important, and a part of my treatment is also, when women want that, to explore how you can feel more free during the sexuality and doing the things that you can more enjoy, how you can feel more, how you can relax more, how you can do soft, how you can do lustful sex. Because I found that if you can do that, then the chances are better that it can be that the intercourse and everything what you work so hard for, it's staying that way. And also because I want people to enjoy sex.
Yes, I want them to enjoy sex. So
Yeah.
many years ago, when I first started my practice, had client who overcome vaginismus, tick the box. And then something did not feel good in my body. Something was wrong. I could feel it in my body, and I didn't know what it was. And I thought about it and thought about it, and then I realized this: my client overcame vaginismus, but my client still thinks of sex as a burden, and my client does not like sex, and was leaving my sessions with her goal. Her goal was overcome vaginismus. But for me, as a fellow woman, not just a practitioner, I felt like I failed. And that was the day I realized they may have their agenda, but I need to have my own agenda. And my agenda is to support them to have a fulfilling sex life for the rest of their life. So what I started to do was I started to plant seeds of positive messages through the sessions, so that they start to understand what I'm trying to say, because maybe the first time they didn't hear it, the second time they didn't hear it, but I just have to keep talking about the importance of not just doing it for their partner, not just treating it as a curse, not just treating it as a burden or a duty or a chore, not just treating it as a religious obligation. None of that. It has to be more than that. And so they may not be at the place to hear that, but I felt that I have a moral and obligation. I just want them to love sex because I love sex, and I just can't imagine anybody not really owning that part. And so beyond vaginismus, I would say exactly what you're saying, which is sometimes I joke about it with them. I say, right now, because of the fear, we are taking small steps, and actually doing some of the same old actually reinforces the safety and the trust to do just that bit more. So all the same old, and then a bit more, same old, a bit more. But in time to come, once you have that foundation and you really know your body and you trust your body, this is when you can do more. So from that foundation, this is when you can explore. I didn't come to love the English language in one day. I had to repeat ABC
Exactly.
thousands of times before I could get to Z. So I always do ABC, and then I'll go on to D, E, F, but I always went back to ABC. So it's building on that foundation. And then before you know it, you start to form words and sentences and paragraphs and essays. And the love of the language doesn't come in one day. It comes by having that repetition again and again. And so I joke with my clients and I say, now we are just talking about the foundation. In time to come, who knows, maybe one day you'll be swinging from the ceiling and doing all kinds of things, acrobats, and go ahead and have fun. So I joke about it.
Yeah, I think it's true that if you only can have intercourse, um, that many people come to me. They say, yes, I overcome my vaginismus, but it's still hurting, and then I think, okay, maybe something can inside of you, but it's still hurting. So for me, it's not the way. Why should you let something inside your vagina that is really hurting? And then they found with my method that they can, even the exercise are playful, and even the exercise are sort of with pleasure and with feeling nice in your body. And it's really different than just a medical approach, because I think the medical approach is really medical, and most of times medical is not pleasurable. And I think sexuality and intercourse can be pleasurable. And if you
Yes.
have the mindset during the treatment, everything time they say, I say, yeah, with softness and pleasure, with softness and pleasure, and it's get a little bit in their head, and at the end they take it with them, and they treat their body with so much more respect. And also what you say is about what you the step by step, that you cannot. Some women want to go really fast, and I say, just like you, what you said. I said to them, yeah, if you want to run the marathon, you cannot do it in one day. And when you say it, it sounds like really easy, but in their head, they really think that sometimes when they have intercourse for the first time, in their head, there is really that it has to be incredibly beautiful. You know everything what to do. You know everything what to do with the other. It's an incredible feeling. But to be honest, I tried to run for about 1 kilometer, and it didn't succeed really well the first time. So the same with sex, it can be nice, it can be intimate, it can be lovely, but you have to learn and
Steps.
explore what is nice, as also in sexuality. And I think that's not only for women with vaginismus, it's also for all the women or all the men also. And it is not like it's like this and we do it like this and we do always like this. You can explore in little details how you feel doing just something else, or a different place, or different position. And for me, you don't have to hang on the lamps or everything. You can do it also small and nice, but you can do with um, uh, because you want it, because you want it not. And some people say to me, some women say to me, yes, when I'm angry, I don't give sex to my husband. And I say, that's really sad, because then you don't have sex also. And then they look at me and they say, yes, but what can you do to feel more enjoyable about sexuality? And that I found out that many women with vaginismus who go this road, also me, before I overcame it, then I enjoyed sex. I did all kinds of things, a little bit because I want to compensate the thing I could not do, but I found out everything what I found really nice. So many women with vaginismus have all spectrum of things they can do, and also the communication between the partner and the woman is many times really well, because they have to talk so much about this problem and how to solve it, and speak with different details how they do it. And if I look at them, then they are most of the time they are really strong couples, because if you can talk about sexuality in this way with such a vulnerable subject, then you can also say different things what is important in the relationship. So I see, of course, not all the women, but many women who I see, they have really good relationships with their husband. also because they have to talk about it.
Yeah. So you are talking about the intimacy of talking about these things and being really vulnerable. So you know, there's so many things in my head what to say, that I forget. I forget what I wanted to say. Um, it's it's not easy to open up themselves when they have the fear, and also sometimes the personality of procrastinating. So I look at why vaginismus goes on for some time. Sometimes because of the fear, the shame, the not knowing who to go to, not knowing the name of the condition, not finding the right person to support them. Also the personality of the person to not take action. So the avoidance personality, and it's so important. This is the reason why it's so complicated, and to seek help, because people who are already finding it challenging, if they don't have the support of their partner, it's just going to be even more challenging. So I always love working with the couples together.
Yeah, and some people ask me from why it's so difficult for people to ask help. I say yes, if you cannot do something like intercourse, if it's not succeed and you feel so full of shame, but also you cannot imagine that there is a possibility that it is possible to have
Yeah.
intercourse. So in their head, it's really strict, Jacqueline, you cannot have intercourse. And for me, even when I met my husband, I said to him, yes, I have vaginismus, nothing can get inside of me. And then
Yes.
he said to me, okay, um, then we have to see what you need uh, to open up. And I said to him, no, you don't understand. Nothing can get inside of me. Yes, I understand, but we need to see what you need. And that was one of the most important changes in my head. Instead of saying all the time, I cannot have intercourse, nothing can get in my vagina, it changed in what do I need to open up. And even the fixed thought in the heads of many women of vaginismus, also because of fear, a fear of pain and fear of um, that it not succeed, so fear of failure. Um, um, if you change a little bit that kind of thing in the mind of the woman, and the steps succeed, the little steps succeed, they get some hope. And that is so important for the woman, that they found out, okay, I could not get a finger inside of me, I could not open up for it. But now, with the technique for me or the explanation for you, uh, I can let a finger inside my vagina, but
Yes.
it was not possible, and now it's possible. So maybe it will be possible
Yes.
to let a penis inside.
Yes.
And that
Yes.
is something that slowly, sometimes really quickly, because some
Yes.
processes are go really quickly and
Yes.
sometimes
Yes.
processes
Yes.
go really
Yes.
slowly.
Yes.
But it changes the mindset in the head, and it's so important. And I think also that it is so difficult for many people to understand what when you cannot have intercourse, what it is inside of you, how it felt to have no intercourse. And some people, also professionals, ask to me, yes, Jacqueline, you make the intercourse too important. And then I sit down and I thought, yes, what I'm going to answer. And I said, yes, if you can have intercourse, then it's what you can do with all the things you can do. But when you cannot have intercourse, it's really difficult. I have people and women who have waited to get a relationship for about 50 years. They didn't have child because they were so afraid. And um, it's so sad that so many women don't dare to date, don't dare to have contact with many men, because they think, yes, I cannot give a man this.
Yes.
And
So what's the point?
it, yeah, so
Yeah.
this is
Okay.
important. And also it's important to let them know um, that sex is really enjoyable, and sex
Yes.
could be
Yes.
really
Yes.
enjoyable.
Yes. Yes. So that's the reason. This is also to not, I remember what I wanted to say, which is that why people are so shocked when things are not going from A to Z immediately is because they are conditioned in porn that everything seems to flow so smoothly that one goes into the another and they don't see all the little steps in order to first master each other's body by yourself. So I do have clients who don't masturbate, who don't know what is an orgasm. So those are all steps to me supporting them to starting to claim their sexuality. And so imagine the shock, you know, on their wedding day when it is not what they thought. And so the shock sometimes stays with them and is kind of like fatal in their mind that just because it is very difficult, that it will continue to be impossible.
Yeah, and that's why I think the explanations about what sexuality is and what you can do and how it progress and in really details, then when couples come to me who have intercourse or trying to have intercourse in their wedding night, they think it's like heaven, and then they do not even touch each other before the wedding night. And then I say to them, it's okay when you choose to do that, but you cannot expect that everything will be okay. It has to be the process that other people do before the wedding. They have to do it.
Yes. So when they come in feeling very, very defeated, this is when I say, well, just because you haven't done it, that just means that you have lots to learn. And once you learn it, then everything is fine. So you just need to learn fast. And I'm here to support you so that you can overcome this as quickly as you can. And it's much easier when there's somebody supporting you. So thank you so much, Jacqueline. This has been so enjoyable. So this has been a 4-part video. So be sure to watch every single one of them because there's so many nuggets of wisdom between the two of us. And we are doing this because we want to support as many people as we can. So please check out our website. So for me, it's eroscoaching.com. I do have a Vaginismus online program. So please check it out. And Jacqueline also has her own website and her book. And the website is overcomeyourvaginismus.com. And her book is called How to Overcome Your Vaginismus.
Yeah. You can buy it on Amazon. So it is over all the world. Yeah.
Great.
So thank you very much for the opportunity and to share our experience. It's really nice.
Thank you.
And that together we can help a lot of women to have a great sex life.
Yeah, definitely we'll stay in touch for sure.
Yeah. Okay. Bye.
Bye.